everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now, alright, obviously with going over the paperwork and talking with you, we've definitely got some issues going on. Now, I know you said the headaches, so you have both headaches and migraines. Migraines you were saying were 1 to 2 times a month. Headaches are almost daily?
Yes.
Okay, so daily headaches, migraines once or twice a month.
Yes.
Now you have neck pain that's been going into the shoulders, and this is constant.
Right.
Okay, and then you said about once a week you'll actually get numbness going down both arms into the hands, and it's just kind of broadly dispersed.
Yes.
Okay, so numbness in the hands, going down the arms, pain, constant pain in the neck and the shoulders, and then I know you were telling me about the low back, kind of like the hips, and then the knees.
Yes.
So, actually, let me have you get a little bit more in depth, because the numbness, a lot of people do experience numbness, so
Okay.
I'll kind of let you tell everybody what's going on, like when you get that, things like that.
Okay, so it's normally like when I'm on my feet for long periods of time. And so there's some days that I'm working 8 hours a day and that I'm on my feet constantly. So it's normally when I'm in heels or even flats, but just even when I'm standing and my shoulders are back and I've got good posture, it's still that once a week or so, it just shoots down and it's sudden. It's not, and then it'll last for like an hour or so, and then it'll kind of disperse from there. But it doesn't stay for hours and hours.
Okay, and then with the headaches?
The headaches are just, I've gotten so used to them that
Okay.
it's just an everyday thing for me.
Okay, so, and those are daily, and any particular activity that increases, decreases it, anything like that? Or?
Looking at my computer or my phone a lot and having my head down is what normally causes them to increase.
Okay.
Yeah. So I can't, because with work I have to, look at my computer.
Of course you do.
So
Can't just stop looking at the computer.
I just can't hey, I'm not working today.
Alright, I know you've seen some of the videos, so I know you see what I do. I do especially that Y-strap decompression at the end, and patients get a ton of relief.
Okay.
Which is why you are here today.
I'm excited about that.
Let me have you stand up first.
Okay.
I want to go through some ranges of motion, just kind of get a baseline of where you're at.
Okay.
So I'm going to have you look all the way up at the ceiling for me. Any pain, tenderness, tightness, pulling, anything like that?
Just a little bit in my shoulder blades.
Okay. And then have you look all the way down at the floor. Any issues with that?
No.
Okay, good. Bring one ear to one shoulder. Any issues with that?
Just in the neck it hurts.
Okay, and then to the other side?
Anything, just tighten in the neck.
Okay, same side or is it that other side?
It's just like this side.
Okay. Because you didn't actually, I don't know if you noticed or not, but when you flexed to that side, it didn't want to go as far.
Okay.
Less range of motion, but
Yeah.
just little things that I just see.
Okay.
I'll have you rotate over either shoulder. Any issues with that?
Not on this side, but on this side I feel it up here.
You feel it? Okay. Let's go to lower body. I want you to bend forward at the waist for me. Any pain, tenderness, tightness with that? Good. I'm going to have you extend back like this. Any issues with that?
Just some tightness in my middle back.
Okay. Does it stay in the middle back or does it ever go down into the...
Just stays in the middle back.
Okay. We're going to have you lean to one side and to the other. Any issues with that?
Just sore from the gym, but
Okay.
no.
Okay. And then just rotating over either side. Any issues with that?
No.
Okay, good. So what we're going to have you do, I'm going to have you lay face down for me.
Okay. On my ass stomach?
Yes, please. I'll have you bring your hands right here. Good. So we are first going to start with scanning the body. We're going to go from that cervical spine, go all the way down, checking the leg length, and then we're going to check the symmetry from the right side of the body and compare it to the left. So I'm just going to be palpating, meaning I'm going to be feeling the spine and the surrounding tissues. Let me know if anything is tender to the touch, okay?
Like all of that is tender.
All of this is tender? Okay. We're going still further down that cervical spine into the thoracic spine here. Okay, and into that lumbar spine. Any pain with any of that?
No.
Good. Any pain over the right SI joint?
No.
Any pain directly over the sacrum or the left SI joint?
Just a little bit on the left.
Okay, so a little bit on the left, and we're going to take a look at the leg length. So, huge difference here. It is extremely short on the right side compared to the left. Now, a couple of things that I'm noticing. So when I look up, the right hip right here is tilted like this, but especially when I was palpating going down, on the left side here is a little bit raised, like that muscle's in here. So we're going to do an adjustment for right through here, and then also that hip as well. Let's go ahead first. We're going to use the massage device, get everything nice and relaxed, and then we'll start with the adjustment. So let's go ahead and get started with the adjustment. And I always like to start up top here at that cervical thoracic junction here. Okay. We're going to start with the T3 here on that left side. Good. Drop down to a T2 on the right. Good.
That already feels better.
Good. Yeah, that opens up a lot of the nerve, that takes pressure off those nerves and allows the body to function as it should. And I know you were super tight up here, actually.
Yeah.
Okay, so take a deep breath in and exhale out. One more time, deep breath in, exhale out. Good. We're going to come back down here to the leg length. Already a lot better. And we'll actually show you this so you see how big the leg length discrepancy is. What I'm going to have you do, I want you to sit up on the table.
Okay.
So I'm going to have you straddle the table, one leg on either side. Okay. Now I'm going to have you just cross your arms. Yep, over the. Yep. Keep your thighs to the table. We're going to rotate you this way. Look as far as you can over this shoulder. There we go. And then face down again for me. Yeah, that left side right through here was kind of pressing out against me.
Okay.
So we wanted to rotate that back to midline there. Yeah, there we go. That's looking better. Wow. Look at this here now. When we bring the feet together, it still, as you guys can see, it still pulls a little bit short on the right, but so much better from right in the beginning. Okay, now we're going to check the sacrum. I'm going to stabilize right here. I want you to raise that right leg up as high as you can. Any pain, tenderness, tightness with that?
No.
Okay, relax that side. Raise the left side for me. How does that left side feel compared to the right?
It hurts a little bit up at the top.
It does? Okay, so I want you to cross the left leg over the right leg for me. Perfect. And the table is going to come up from below. Okay, so what's happening is your sacrum, the apex of the sacrum is starting to point more towards the right side. So we're going to do P to A drops, just meaning from posterior to anterior. And we're going to put a clockwise torque so we can bring that sacrum back to midline.
Okay.
Good. I'm going to have you uncross and bend just this knee. Yep. And one more. There we go. And down. Okay. So I want you to raise that left leg up again for me. Do you notice the difference?
Yeah.
Good.
Feels so much better.
That actually went up quite a bit higher too with that. Okay. Still just where it was when we left off. Come on in, take a look. Still a tiny bit short on the right. So we're going to just lightly press into that lumbar spine. Any pain or tenderness down here?
Just a little bit, like right there.
Okay. Alright, I'm going to have you first lay on your side facing me this way. Open that up. Good. So we're going to bend that top leg. Good. Let me take this hammer. I just want to drop your shoulder down a little bit. Yep, right there. There we go. Flip to the other side. Good. Yep, drop that shoulder. Perfect. There it was. Lay flat on your back for me. Okay. So from here, we're going to do a leg pull. With the leg pull, you'll feel release in the ankles, the knees going up to the hips.
All right.
So just relax your leg. And I'm going to have you stand up. And I'll have you stand right here, facing the front. Good. Bring your arms out by your side. Yep. My hands are going to come up and over. Perfect. Lean back onto me. Squeeze your elbows together. Tighter, tighter, tighter. Oh, you felt that, right?
Yeah, that feels so much better already. I feel like a new woman.
Good. Well, that's the whole point of coming in and getting the adjustment. Starting to feel that relief.
Mm-hmm.
Okay. So we're going to do one last adjustment on that thoracic spine here. Okay. I want you to take a deep breath in and exhale out. Good. That was already cleared out there. So now
Yay!
we're going to do that Y-strap.
Okay.
So with this decompression, you'll feel this up top going all the way down. I'm going to need help with your hair though.
Okay.
Just let me make sure none of it. All right, perfect. And just relax.
Oh wow.
Breathe from a deep breath in. Exhale out. So I'll have you relax here just for a little bit.
I feel so much better. Oh wow.
Now, the one question that I always ask everybody, how would you describe that to somebody who's never had that done before?
Like heaven. I don't even know what heaven's like yet, but it felt really, really good.
Good.
It like went into my shoulder blades and all the way down, like into my hips too. Like never had that done before. It was so good.
A little bit different than your normal.
Yeah, it felt amazing. Really amazing.
Good. All right, I'm gonna have you come on up.
That was so good.
I'll have you stand up again.
Okay.
Kind of run through those ranges of motion. Look up, look down. Granted, I know you weren't in any like pain really. You felt
Right.
the pulling, but how is it now? Do you
That
notice
was
the
good.
difference?
Yeah, that was really good.
Good.
Yeah.
We'll have you bend forward at the waist and
Okay.
back up.
Yeah, that feels a lot better in my hips. Like I don't feel that in the like bottom part of my hips anymore.
Good. And then yeah, like leaning to the sides.
Yeah, but I feel so much better. That's amazing.
Headache?
No, my headache's gone. That's great.
Did you think you were going to be feeling like this after like one adjustment?
No, not at all. So, yeah, come see him.
This is exactly how you should be feeling, like after an adjustment.
Yeah,
So, perfect.
smile on your face. Thank you.
You're very welcome.
Yeah.
Alright guys, so if anyone is ever looking to schedule an adjustment, just go right to the website, drcipriano.com. Send us a message and I would love to help you out as well. Have a good one, everybody.